Hi and welcome. I'm Dr. David Ajibade with the Brain and Body Foundation, and this is the beginning of a four-part series on breast cancer in Black women. And I tell you, this is such an important topic, and there are so many things here that I feel that Black people need to be talking about. Mothers need to be teaching their daughters and their granddaughters about this problem so that people can be better prepared to be able to prevent it, and if they do get the diagnosis, to be able to deal with it, because I'm telling you, it's rampant, and unfortunately not too many people know how to handle it like it should. So I want to thank Dr. Jacqueline King and the team at BWE for this privilege for me to be able to share this. Remember, this is about four parts, so please stay tuned. Bring your notes, tell your friends, get them all together. Let's have some group meetings on this topic, because like I said, I think it's super important. Now, the goal of this four-part series is not to scare you, but really to awaken you to these realities. But more important than that, to be able to help you know exactly how cancer happens and exactly what to do to prevent that thing to prevent cancer from becoming cancer, if you know what I mean. So there are things that people do. Yes, your genes are important, and there are things that they don't do. And of course, the environment too plays a role. The genes, the lifestyle, and the environment all play a role in whether or not you get breast cancer, as well as any cancer or any disease. Those three things are super important. But if we can highlight those things, which we're hoping to do in this four-part series, you should be able to know and protect yourself against these things, and of course, help other people likewise. So please, like I said, stay tuned. There'll be a lot of information on the slides we'll be showing. So, and these slides will be available on our website. You can go there and download them for free. Before I start with the whole presentation on cancer, I want to say a few things about myself. Like I said, I'm Dr. David Ajibade, and I'm from, let's put it this way, the country that has the most number of Black people on the planet. Can you guess which one that is? I'll give you a few seconds. The country with the most Black people on the planet. In fact, they say one out of every four people is from, and every four Black people you see is from that country. Yes, it is Nigeria. Yes, famous and infamous for different reasons. Anyway, I trained there, and I got my medical degree there, and I started my practice. I started my career rather in the field of radiation oncology, and it was while I was treating those patients. It was while I was working with those patients, I began to see and understand that there were other things that need to be factored in: our thoughts, our words, our beliefs, our energy levels, our nutrition, our relationship with others, the kind of work that we do, that all play a role in whether or not patients recovered from their cancer, or whether or not the treatment worked like it should. I mean, it was so stark, it was so clear. I remember case after case after case of women, whether not just women now, but people, excuse me, not just women, but people with cancer who, there's one I can remember really well now, that she had advanced breast cancer, but she had this business that she wanted to go back to. She had this really positive attitude. She was a strong Christian. And I saw that, and I worked with her. I mean, there's a scripture I always use on every patient, whether they were Christian or Muslim or atheist. I would always start with that, because I needed them to cooperate with me, not just on the external, but the internal as well. And she cooperated with me big time, and I'm happy to say we got her through, and the treatment worked tremendously well. And last time I heard from her, she was doing very well. So the idea that I'm trying to pass across is that there are things that are in our power, that if we were aware of them, that we would be able to handle things like cancer more effectively. So as we progress, please be sure to tune in, send in your questions, send in your messages. We'll be glad to answer these questions for you. Before we get into cancer specifically, I want to talk about health challenges among Black people. I think again, it's not really as shall we say, documented and spoken about in my opinion like it ought to be. Like for instance, now we now know that black people in general have it worse when it comes to hypertension, other cardiovascular diseases, diabetes, um, cancers of different kinds, especially prostate, colon, and breast cancer. Um, Obesity, black women have it worst of all. These are all conditions, and you can see a list of that on the screen in front of you. These are all conditions that we're now seeing are more prominent in black people. And we go beyond that. I will be talking, I'm definitely going to be talking more about cardiovascular disease and diabetes and things like that, strokes as well. But since we're talking about cancers, I want to pinpoint on breast cancer and prostate cancer because the prostate cancer is for men. Only men have prostates. Men also have breasts, but breast cancer is extremely rare in men.